This is a rally at Jacobi Hospital in the Bronx today by healthcare workers and nurses and others over the lack of basic PPE and basic on-the-job safety. It's a speak out about the lack of safety protections that frontline workers are facing. I know many transit workers can relate, but many of these nurses have it much worse than we do. And the rally is going to be starting shortly. So just figured I'd go live and give you some video. We're going to be putting up video as the day goes on. And we're trying to build unity with these workers to publicize their fight and to also unite their fight with the fight of transit workers and other frontline workers facing these attacks. So I'm going to be quiet for a little bit so that you can hear the chants and the rally. So I'll be shooting the whole event live. As you can see, there's a lot of news media showed up. We have New York One and other media outlets are here covering the event. As you can see, all of the protesters are socially distanced, 6 feet apart to maintain public safety. And it's going to be interesting to hear some of their stories. I was at another rally at Kingsbrook Jewish Medical Center earlier this week, and some of the stories they tell are of nurses needing to wear garbage bags because they are unable to get the full body covering that they need. And one nurse at I believe it was Mount Sinai died over exactly that kind of lack of basic PPE. Right now it's just a silent protest, so I'm going to stop speaking so we don't interfere with that. But speeches and rally chants and all of that should be happening shortly.
All right, everybody got their chant sheets going?
Yeah. Yeah, you need one? You can take one.
You don't need it?
No, you can take mine. I'll follow along.
Sure?
Yeah, I'm positive. It's okay.
Thank you.
Yeah.
What do you have? Okay. Got it. You
Yeah.
got it.
This is one of the signs that they're holding: respect public hospitals, nurses, and our patients.
So, is everybody happy about this?
No!
So, we're going to start it off just to let you know how things are going to go. We're going to chant for a little bit, show everybody how we feel for a little. We're going to talk to the press, and then we're going to go around, and if anybody wants to speak and talk about how they feel about what's been happening in this hospital and our healthcare system for the last month, we can have people come up to the front and use the bullhorn to speak to our crowd. And then we're going to do a little march around the area, that'll be it. But I think we got some good chants. I think we want to start it off, Kelly?
This is Kelly Cabrera, the chair of NICENA here at Jacobi. She's going to be leading the chants.
We're going to talk. We're going to have an actual precedent in about 4 minutes. So.
Well, can you maybe face this way then? At least with the cameras are all set up here. And then it's better for social distancing too.
Sure. I mean, we have our social distancing markers, and the camera can set up, wherever you guys want to. So.
We already set up.
Yeah, we're gonna speak. I mean, everybody's gonna be here. We shouldn't have to say it twice. Respect our sacrifice.
Shouldn't have to say it twice. Respect our sacrifice. To say it twice. Respect our sacrifice. You have to say it twice. Respect our sacrifice. You have to say it twice. Our sacrifice. Shouldn't have to say it twice. Our sacrifice.
Shouldn't have to say it twice.
Respect our sacrifice.
Shouldn't have to say it twice.
Respect our sacrifice.
Shouldn't have to say it twice.
Respect our sacrifice.
Shouldn't have to say it twice.
Respect our sacrifice.
What do we want? What do we need?
PPE.
What do we want?
Respect.
What do we need?
PPE.
What do we want?
Respect.
What do we need?
PPE.
What do we want?
Respect.
What do we need?
PPE.
What do we want?
Respect.
What do we need?
PPE.
What do we want?
Respect.
What do we need?
PPE.
What do we want?
Respect.
What do we need?
PPE.
We are essential.
We are not expendable. We are essential. We are not expendable. We are essential. We are not expendable. We are essential. We are not expendable. We are essential. We are not expendable. We are essential. We are not expendable. We
If we work sick, you get sick.
If we work sick, you get sick. If we work sick, you get sick. If we work sick, you get sick. If we work sick, you get sick.
If we work sick,
You get sick.
when we get sick, the
Bronx
gets sick. When we get sick, the Bronx gets sick. When
We get sick, the Bronx gets sick.
When we get sick,
The Bronx gets sick.
when we get sick,
The Bronx gets sick.
Okay, so I think we're just gonna take a few minutes to talk to the press that have arrived here, and then we'll hear from each other about what's going on. So, welcome everybody. Okay, you set up? All right, that's fine. Yellow spots in the back, including reporters. Yeah, 6 feet. We are contaminated. There's no question about
Everybody good?
it. I'm good, yeah.
We're good.
Yes, this is Jacobi, Melissa Ruiz. Sorry, I can't message back, but yes, this is Jacobi. They have circles on the ground here to measure out the social
Welcome,
distance.
everybody. Thanks for coming out to hear what we have to say as nurses and nurses' aides and clerks and a range of other employees from Jacobi Medical Center, part of Health and Hospital. This is a show of unity. We represent all of the employees here that are being subject to this unfair policy that we're discussing today. My name is Sean Petty, S-E-A-N-P-E-T-T-Y. I'm a pediatric emergency room nurse here at Jacobi. I've been here for 12 years. I've spent my entire nursing career here. So we are here today to provide some much needed attention to all the really amazing things happening during this crisis, but also some things that are pretty shameful. In the past week, we have turned a corner on this virus. We are winning. Our hospital beds are opening up. We're able to help out our sister hospitals, taking patients from Elmhurst and Queens hospitals. Over the past 3 days, we have extubated over a dozen patients. One of the amazing... One of the really, I think, amazing things happening here, like at other hospitals, is every time a patient is extubated, we play Fight Song, which is just one of the few things that, in one of the most horrible months of all of our careers, most of our lives, to be able to have some victories and to be able to celebrate some victories together as a workforce, I think is one of the great things, and it's genuinely inspiring. We're also being showered by donations of meals, desserts, snacks, gift bags, other messages of solidarity and support. Children and adults are drawing us pictures, vending pots and pans at 7 o'clock, and praising our sacrifice that we've been making over the last month. our doctors, our attending physicians and residents come up with dynamic solutions to real-time problems and be working 80 to 100 hours a week fighting this thing. Nurses have come from all over the country, from South Carolina to San Diego, to Florida, to Texas, from Texas, to help us fight this virus. I can speak only for myself here, but I've never felt this much support from fellow New Yorkers and fellow people all around the country that I have in the past month. And we desperately have needed that support because it has been one of the most traumatic months of all of our lives. But our healthcare system, well, we absolutely want to give credit to having facilitated some of these key areas of support, has just done something unusual and cruel. We began this crisis without a true healthcare system. We had a hodgepodge of public and private institutions, rich hospitals, poor hospitals, city, state, and federal agencies who were all on different pages and not working in any seriously unified way to deal with what we needed. In New York State, we started out this crisis with 20,000 less hospital beds than we had 20 years ago, along with less doctors and nurses to staff those beds. This non-system failed to create the mass testing capable of containing this virus, as other countries readily did. This non-system failed. This non-system failed to stockpile, produce, and otherwise procure the very basic tools that we needed to protect ourselves. The N95 mask is being called by some the gold standard of protection. I want to challenge that. That makes it seem like a luxury item. When it's the difference between life and death, or a tube down your throat, or being able to come back to work, there's nothing golden about an N95 mask.
Yeah.
The N95 should be a very basic weapon in this war. And we have just in the past week, through our relentless speaking out, forced the state of New York to procure enough to get anyone who needs it one N95 per day, as Governor Cuomo announced earlier this week.
One per week, yeah.
And that was from a policy that we had fought originally in this institution and in others around the city, public and private, where they made us have one mask for a whole week. That was what our battle was about. I can definitely say it cost us a number of people in terms of a number of hundreds of people that have gone out sick because we didn't have that level of protection. If we're going to talk about gold standards, we should be talking about poppers, which are reusable power air purifying respirators that they had in South Korean ICUs. We should talk about head-to-toe impermeable bodysuits, 4-hour shifts, donning and doffing rooms with observers, negative pressure rooms, safe, secure elder and child care for healthcare workers, housing away from vulnerable family members, laundered scrubs, meals, liquids as testing for viral loads and antibodies readily available, and of course the fit-tested, non-corrosive N95. That's a gold standard. If that's provided for healthcare workers fighting this virus, I would gladly call the whole thing a luxury item in exchange. Even though some countries that are poorer than the United States but had better healthcare systems met this standard with ease. Instead, we've had the shameful symbol of healthcare, the brown. Whenever you see this bag in a hospital, you should think of failure. Failure of the federal government to protect healthcare workers. What that paper bag means is that healthcare worker has to reuse a mask that was always meant for one-time use. Whenever you see this bag in a hospital, you should think of healthcare workers getting recontaminated by their own masks. And you should think of nurses getting sick, you should think of some of them getting intubated, and you should think of some of them dying. We are finally being heard regarding the science of the airborne nature of this virus and the need for N95s. Governor Cuomo finally discussed the airborne nature of COVID-19 in an update that he sent out earlier this week for the first time. And we're just finding out today that also in response to our efforts Mayor de Blasio has created for the first time a citywide hotline for nurses to be able to call and deliver and obtain. If they're having problems getting PPE in their hospitals, there's a citywide hotline that we can call now, which hopefully will work to function to clear out some of these. Because we're still finding problems. When we were going around talking to nurses about the problems we've been facing this last week, we still heard people not being able to get replacement N95s. We still heard the fact that our hospital still doesn't have times that people can get replacement equipment. So the fight is not over yet. So we got sick by the thousands, and some of us died. And many of us are still sick. We are still recovering from the trauma of this war. The dead patients we've seen, the impact on our families, the co-workers and loved ones that we've lost. And yet a profound insult has just gotten added to our numerous injuries. On Friday this past week, 7 days ago, our hospital system announced a new policy that threatened to take away some of our sick time. They want us to seek documentation for every time we are unable to come to work because of illness, whether it's physical or psychological. For starters, after all we've given to this fight, this is simply a brutal slap in the face for our efforts in this war. This is a dishonor to our collective sacrifice as public hospital nurses in the most deadly pandemic that we've had in this country in 100 years. In addition, it potentially violates numerous city guidelines and mandates around social distancing. What if a nurse or a clerk or a housekeeper can't access a telehealth network to get a doctor's note? Why are we overburdening our telehealth care system in this moment anyway with unnecessary documentation? Many nurses have been referred by telehealth to hospitals for documentation. Are we supposed to expose ourselves and other community members to get an unnecessary piece of paper?
You know, trans workers.
I want to thank the nurses of Lincoln Hospital for speaking out publicly about this issue. Last week, the administrators of that hospital implemented this policy earlier before it was implemented on a citywide level. Perhaps it's telling that they experimented with this punitive treatment on the hospital in the poorest congressional district in the country. And I worry that people who make these decisions might think that workers in the public hospital system, who are predominantly women of color, are easier to treat this way. This policy needs to end. It's cruel, insulting, and unnecessary. Maybe if they reverse this policy quickly, we can work together and rebuild the trust necessary to work together and build a better healthcare system in these unprecedentedly dangerous times. But if this is how we're going to continue to be treated after all we've been through, how do we expect to meet any serious public health care challenge in the future? The public health care system in New York City is critical. It is the only system that treats everyone, regardless of ability to pay, regardless of insurance status, regardless of the color of your skin, regardless of their immigration status.
Woo!
Our administrators need to love our public health system as much as we do. And we should protect and nurture what we love, not abuse it. Thank you.
Yeah! Woo!
If there's any nurses that want to come and speak out, please come. I know I'm great. I picked one. Woo!
Yeah!
My name is Marie Gallen. I work in the emergency department.
Speak up into the mic.
My name is Marie Gallen. I work in the emergency room, and I've been there for years. We do have a policy for you. You need to have a doctor's note after 3 days. In the middle of a crisis, in the middle of a pandemic where we're fighting for our lives, they changed the policy. Are you kidding me? Huh? We are trying to save people's lives, and while we're putting our lives in danger, our families, our loved ones, and they try to change the policy in the middle of a pandemic. This is outrageous. They pretend that they love the nurses, but our leadership, I don't know what they are thinking. This is not love. We don't see any love in that. Trying to tell us we need a doctor, no, when we can go to the doctor. Right. How are we going to get it?
It's unbelievable.
Huh? This is crazy. So this is why we're here now. So we want them to stop and help us while we're helping our patients. That's all we need.
Yeah.
And your last name?
That's my last
Oh,
name.
and your first name is?
M-A-R-I-E.
Thank you.
Who's next? Okay.
Yeah. Yay.
Good afternoon, my name is Michelle Shaw, S-H-A-W. I'm an inpatient med-surg unit. Thank you, Sean. Thank you.
Yeah. Yeah.
I will thank you all for taking the time to come and speak to us. I've been a nurse at Jacobi for approximately 7 years. My biggest issue is I am now COVID positive, so I'm a survivor.
Yeah.
However, my concerns are we came into this pandemic unprepared, no equipment, but we're fighting and we're still fighting. My initial thought being COVID positive was, after feeling my symptoms, I came to my hospital to ask to get tested and was refused testing
What?
for a whole 4 days. I literally drove over the bridge to come here
Christ.
and had to beg my management to test me, and they refused to do so. Initially, after 4 days of fighting, I got tested. As I got swabbed in my institution, before my specimen was labeled and sent off, I was told I am afebrile, wear a mask, and go back to work. My specimen has not even received the lab testing at that point.
That's
This
crazy.
is unacceptable, and this is why we're spreading, and this is why we're in a pandemic.
Wow.
Sure enough, 3 days later, I got the result of being COVID positive. Now my concern are I don't have a fever. Fever is not the only indication that someone is positive. I am weak, I can't get out of bed, but I was still told to come back. I was willing to come back, and I try to fight a good fight like my fellow nurses, housekeeping, and all our disciplines are fighting. I came back after 2 weeks of coming back, could not get an N95 mask. It took me 2.5 hours to get a mask, and I had to say, listen people, I am positive, I am here, I need help, I'm trying to go back to fight this good fight that we're fighting. 2.5 hours for management to give me an N95. Upon receiving that N95, and I actually have my documentation, I went to what is known as our command center. I was given a paper to sign with weekly assignments, and I was told that once I got this mask, I could not get another mask for another week. This was as
Sound
up
familiar,
until
transit
yesterday.
workers?
That was information given to me. So me being positive, still coughing, going around my patients, I have one soiled mask that I'm now able to use for the next week until next week, Thursday, before I will be issued a new mask. How is this acceptable in America? Please, someone let me know. Another issue is management is here saying mask is available. We're here fighting every day. However, we're not getting the mask necessary. Not one time did management call and say, are you okay? How are you feeling? How is your family? The concern was, are you afebrile? Can you come back to work? Where's your compassion? We're humans. We're in this together. Please, let's fight this. Be compassionate towards us. So this now at the end is a slap in the face that we're told we're sick, we can't get paid. How is this possible? We're sick, we're human beings here, and we can't get paid for being sick. You're overcrowded, violating our social distancing to get out to get to a doctor. So the whole point is we're here fighting for everything, for everyone to get better. Give us the supplies we need. We're fighting sick. We have lost nurses. We have lost all other disciplines. Who's not intubated has been dead. It's unfair to see us suffering when we could be saving lives based on the fact of just giving us the correct equipment that we need so we can keep on this good fight. Thank you. Thank you.
Yeah.
Let's get somebody else.
Hi, my name is Olivia. I am a nurse in the surgical ICU.
Yeah.
Stated that I am not a robot. I am a nurse. And this is my passion as a nurse to work. There's many times we have worked without any food. We're unable to take a lunch break, bathroom break. Most heartbreaking to me is that I had to take care of my fellow nurses in the ICU. Mentally, emotionally, and physically, we are tired, we are drained.
917.
And for
577.
administration to say,
06.
taking a day off because we are sick, may not be physically sick, but could be emotionally, mentally, it's heartbreaking to know that we are leaving our lives on the line for this hospital, for our community. And we have to work without just one day off. Come on. We have hearts. You guys have to have hearts for us too.
Yay! They wanted to spell her last name.
Lewis, Lewis.
Thank you. Spell your name.
Hi, my name is Alicia. A-L-C-I-A.
Pick up, Alicia.
Okay, I work in the emergency room. I was told they called out sick. I was supposed to go for surgery, for knee surgery. I'm working with a brace. And if I stay out, I won't get paid because I need a doctor's note. Mind you, the surgeon who's supposed to operate me and cancel my operation told me he can send me a note right now. So I am working with a splint on my knee. And beautiful nurses out here, they're being compassionate so they know that I can't run around too much, so they look out for me. But you know what? They need to hear us. They need to know that these nurses here are working very, very hard to keep these patients alive. I've been here for almost 39 years, going on 40 years. I shouldn't be told.
Wow.
When I'm sick because I don't have a doctor's note. No. I don't think I
Graceful.
should be told that. Like I said, thanks to all these nurses out here, thanks to my Sean, Harry, Mr. Superman, who did this and let me be able to speak out and let them know that they're all working very hard and they need to be respected.
Yeah.
Hi, my name is Michelle. I work in the adult emergency room where we are basically struggling for our lives in there and for the lives of our patients who we are continuously exposing to the virus because we're wearing the same gown for the entire 12-hour shift. And as one of my coworkers said, we have waste on our gowns, on our masks, on our goggles, the same ones we have to wear every single day. There's no privacy for the patient. They are trying not to be each other. And then the governor and whoever is saying that we have enough, the president is saying we have enough PPE. We do not. We have to fight and sign for every single PPE we have. From gloves to this thing I'm wearing over the Christmas gloves. And then when you come, they don't have your size. And you have to come back. This time you put wipes to bright on the area and just like, come on. We shouldn't have to be living like this. This is crazy.
Yeah. Woo! Woo! Yeah. Woo! Getting some love from Pelham Parkway.
Hello, I just want to say that this new policy that's been instituted by Jacobi is one of the most egregious ones to date. We are working to take care of our patients, but we have to take care of ourselves. We don't take care of ourselves. We don't take care of these patients. We're just asking for the respect that we deserve. When you're on an airplane, they tell you to put your face mask on first before assisting others. We need to take care of ourselves so we can take care of our patients.
Yeah.
Jacobi to revise their policy.
Can you say your name?
Jacobi needs to revise those disrespectful policies that we need and doctors know for each sick call. And also, why are they sending us out into the community when we're supposed to be social distancing? Just to get a doctor's note, really? Ridiculous.
What's your name?
Tiffany Fairweather.
Yay!
That's good. That was a lot of great stuff there. We got 2 more speakers and then we'll be done.
Hello, my name is Judy Sheridan Gonzalez.
Yay!
I'm the president of the New York State Nurses Association and an ER nurse at Montefiore Medical Center in the Bronx, right on the other side of Pelham Parkway. So we stand here with our brothers and sisters in the public health system because we are all taking care of the community, the 62nd in health indices in the entire state of New York. And I would like to show you something. This is our gold standard, this thing here. This is what we have to beg. In the very beginning, people were being threatened with discipline for wearing one of these. We knew that this virus was airborne, and we were threatened with termination if we obtained an N95 to wear. Then, when they started to see us drop like flies, they decided they needed to give us one. Once a week. Reuse it. Clean it. How do you clean this when it's filled with germs? We had to fight, we had to struggle to get one a day. That is not the gold standard. The gold standard is a pepper. The gold standard is a hazmat suit that they use in other countries. That is the gold standard, not this.
Yeah! Woo! Woo! There's our co-workers showing love for the nurses.
CW100's in the house.
Yeah.
We wonder why there was no storage of these supplies for us. If you have a for-profit system, it's not profitable to have a storage of supplies. It's not profitable to have ventilators. It's not profitable to protect people from a disaster. But we are the ones who had to protect people from a disaster, and our community that supported us. My son and his friends, 2 boys from the Bronx, did a GoFundMe page and got thousands of masks for us. That's what our community's done.
Yeah.
We're distributing them directly to the nurses because we don't know if our hospitals are hoarding the supplies or if they're somewhere and where.
Yeah.
And to add insult to injury, they're harassing all of us for sick time. In my own hospital, the governor of New York said that workers who were getting sick from COVID would get 14 days of furlough pay. Does everybody remember that?
Yeah.
At my hospital, they said that you had to get Department of Health approval for such days, and you had to have a positive test. Meanwhile, they weren't testing, and the Department of Health is unavailable. I had symptoms a month ago. I was approved for a test on March 17th. I got a call today if I wanted a test. I told the lady that she died. She was a little shocked. I said, no,
oh, I'm okay. The point is, it's a Ponzi scheme. They say they're going to give you sick time, and then you don't get it. And if you don't have any in your bank, you don't get anything.
Well, that's crazy.
You're sacrificing your life, you're sacrificing your family, you're sacrificing everything, and this is what they do to you? This is an outrage. Like I said, we are essential, we are not expendable,
Right.
we will take
That's
care of our
right.
patients, but we need to survive to do so, and we need our facilities and our government to respect us, and we need to get profit out of the healthcare system once.
Yeah! Woo!
My name's Kelly Cabrera. Kelley Cabrera. I'm a nurse here in the adult emergency room. I'm also the president of our LVU here of NISNA.
Yeah!
First off, I want to say thank you to everybody who came, including all of our fellow co-workers here, our nurses, all of our staff. And also thank you to the community that has really shown up for us in ways more than our local, federal, state governments have for us.
Yeah!
Because it's been through the goodwill of everyday hardworking people, where people have given us donations from across the country, and letters and memos. All of those things have really helped us, and in ways, if it wasn't for those donations, we don't know where we would be. So really thank you to all our community for that. So our system has been historically understaffed and underfunded for years. This is something that we have always known, but this pandemic has made abundantly clear. It's also shown a light into the insidious relationship between private and public sector hospitals. We are the safety net, and we are proud to work for this system. A system that cares for all New Yorkers regardless of ability to pay. We take care of this city's most vulnerable populations, and we are so proud of that. But please, do not forget about us whenever this pandemic is over. We are finally starting to see the effects of social distancing take place. However, our ICUs and our floors are still very full. Many of our staff nurses and other frontliners here as well have been infected and are out sick. Some have even died. While we currently have a sea of volunteer and agency nurses here, familiar faces are hard to find. What happens to us, our city nurses, when the agencies leave? What happens to the patients when the newly open spaces, which we've advocated for years, they finally close down due to low census? What happens to our hospital system when we see the effects of the hundreds of millions of dollars of budget cuts that just started to take place? Do we go back to the overcrowded EDs, tired down nurses caring for 10, 15, 20 patients? We must put an end to the years of abuse that our staff has endured. This sick time memo is just another slap in the face of the hardworking nurses who have dedicated their lives and careers to this city. It is long overdue that we stand up for our rights as protectors of this city. If we work sick, you all will get sick.
Hey! Hey! Woo!
We can take a couple questions before we go on our march. Does anybody have anything?
Can you talk a little bit, how many healthcare providers here have died?
We can say that we know of at least one nurse and one nurse's aide that have died since this crisis. Actually, the first nurse that died, the second nurse in our system, the second nurse in New York City died in our hospital. Her name was Freda Okran, and she was an educator in our psychiatric department. We found out she died at the end of our first rally that we had 2 weeks ago when we were protesting. And her son actually talked about how she had been advocating and fighting for getting tested for herself and her coworkers for at least a week or two leading up to her death.
Would it be okay if
So we know that she was
workers?
a
I don't know
proud
if that's
member
okay
of
with you.
NISNA, and
Okay.
she'll be sorely missed by all of us. We know that there are more.
Cal,
we know that
I need another
we
favor.
don't-
I need you to videotape
what's
it
kind of
because I'm live
disgusting
on
is that the
Facebook.
city
Thank you so
doesn't
much.
have a very sophisticated tracking system for tracking healthcare workers. They've been able to report some of the nurse deaths, but we don't think they have a full accounting of all the nurse deaths in our system, and we know that they don't have a full accounting of nurses' aides, housekeepers,
PCAs.
there's PCAs, RCTs. We know they don't have a full accounting of how many of those have died, but I know of at least one nurse and one PCA that have died since this crisis began in our hospital.
Yeah, I know. Yep.
Yeah, we're all we're saying is you have mechanisms for this emergency measure that you've taken to deal with the problem of individuals who, maybe have a particular issue with their sick time, or people. You already have a policy of 3 days that after 3 days, because that gets for a shorter term illness. Then you already have that policy on the books. Why punish every single employee in the system? Why threaten to take away their pay immediately, which has already happened to people as of this week? So the policy got been on Friday. It's already been happening to people. And so why in this time when we already are at the beginnings of an economic depression, health and hospitals employees are often the center, the economic center of their communities. Most of our family members have lost their jobs, are struggling financially, and for them to try to take away more of our pay and more of our ability to help out the people who are struggling right now in our communities is just disgusting. And so we are, we absolutely need this policy to go away, and we don't see any reason that any humane person, once they know what is at stake here, will continue this policy. So we hope that our administrators do the humane thing.
Not to also mention the fact that so many of our nurses and so many of our coworkers here, that not just nurses, everybody that works in the hospital, so many of us are caregivers at home, family members.
Right.
So people take care of sick people in this hospital, and they go home and take care of their sick families.
Right.
So
Absolutely.
This is an absurdity, a slap in the face to all of the workers here that have been faced with one of the greatest healthcare challenges of our time.
Right.
And the fact that we're being punished for trying to do our job and trying to keep our mental health safe, our physical health safe, being that we didn't get the protection that we needed in the beginning. And we're seeing all these effects take place now. So this is insulting to every person that is affected by this policy across the system.
Absolutely. Yep.
Let's do a show of
All right.
hands. Let's go.
Yeah.
All right. We're gonna do a little socially distanced walk around the hospital, okay? So we're gonna start up some chants. We want to sing single file, 6 feet apart. We want to let every administrator in this hospital know what we think about this policy. We want to let every patient to know, and every nurse that's in there taking care of their patients. We want them to hear exactly what we have to say about this policy. So we're going to do a little march. We're going to go back out that way. Just follow Kelly. She's going to have the bullhorn. Right, Kelly.
Where's the champion?
Yeah, here.
Oh, I know the one it is. We don't got to wear signs on our outside.
Get to the front. Go down. We'll walk down the road.
That's it. That's in front. Sorry about
PPE. Respect. PPE. Respect. PPE. Respect. PPE. Respect. PPE. We are essential. We are not expendable. We are not expendable. We are not expendable. We are essential. We are not expendable. We are not expendable. If we work sick, you get sick. You get sick. We work sick, 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 you get sick. They say cut back. We say fight 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 back.
Tell him.
We say fight back. We say fight back. Everywhere we go, people want to know who we are. So we tell them. The healthcare workers.
That one fell apart. That one didn't go. We are not expendable.
Essential. We are not expendable. Essential. We are not expendable. Essential. Essential. We are not expendable. Not expendable. Essential. Essential. We are not expendable. Essential. Essential. We are not expendable. Essential. We are not expendable. When we get sick, the Bronx gets sick. When we get sick, the Bronx gets sick. The Bronx gets sick. When we get sick, the Bronx gets sick. When we get sick, the Bronx gets sick. The Bronx gets sick. The Bronx gets sick. The Bronx gets sick. The Bronx gets sick.
The Lord told me I was loud and I decided to be louder. Was you going back in, Lori?
No, I'm off.
You're off? God, I wish there was an essential bar. I know. I'm struggling so hard, Kelly. Just give me an essential bar, I'll be better.
Hey. So Kelly, you forgot, I think. Right?
Oh, I'm sorry?
I said, I think you forgot.
Oh my gosh. Oh.
I mean, I could use the bullhorn. Yeah, I don't know if it's gonna happen. Yeah.
They're a little.
I got to help my
Well,
You want to use the bullhorn?
yeah, that's fine. There you go. Whoa. Yeah. You gotta hold this and turn around.
All you have to you press the button and press into it like a walkie-talkie.
Okay. Hello, everybody. How you doing?
There you go. Yeah, press hold. Keep it holding.
There we go.
You gotta speak kind of loudly into it.
Okay. Hello guys, how you doing? My name is John Ferretti. I am a shop steward with PW Local 100. I'm a train conductor. I'm also part of a coalition of rank and file members for Local 100 Fight Back Coalition. And we're here today in solidarity with you. You know, we want you to know that you're not alone. You are never alone. Working class people have your back. We face the same conditions you have. I mean, I can't even imagine the conditions you guys are facing, but I want you to know that trans workers know what you're going through, that we have your back. We know from personal experience the consequences. Over 70 members of our union are dead. 1,000 of our members are quarantined. 1,000 of our members are positive. 6,500 plus are quarantined. That's why the subway is collapsing. And de Blasio has blood on his hands for what he's doing to you nurses and you medical professionals. So does Cuomo. The whole damn system is guilty as hell. And it's because, as Judy said, it's based on private profit. It's based on parasitical greed. Trump is not the only one who's a greedy bastard who doesn't care about our lives. The whole system is based on it being run by people who fundamentally will walk over our dead bodies and they cry their crocodile tears like they're with us. If they're with us, they need to do the things that are necessary to support us. One more thing I wanted to let you guys know, we'll be doing live streams. We have one this weekend with transit workers. Sometimes you get like 2,000 people at a time to watch these live streams. It's important for your stories to be heard. Contact me. We can have you on these live streams. Also on May 1st, there's going to be actions all over the country. There's a mass sick out, a mass strike over these issues. We should all be networking about how we can get involved. Thank you.
Thank you. I got it.
Go, my Coco. Thank you, Kelly.
Thank you. Thank you guys.
Thank you for having us. Thank you, Kelly and everyone.
Yay!
Let's hear it for Kelly and Sharon. Kelly.
Yeah! Woo! Hey, how you doing?
Good. Do you have a card?
Yeah, sure. Hold on. Get in my pocket here. It's a little hard to do with gloves on.
Thank you very much.
You're welcome.
I'm a reporter and I teach journalism at Lehman at CUNY.
Okay.
And so I might send some students to you.
Great.
Yeah.
Yeah,
Okay,
no
great.
problem.
Thank
Great.
you.
Thank you so much. Okay, the rally is going to be wrapping up, but you know we'll be at every other demonstration that we can, and we'll be keeping you up to date with the stories of nurses. Like I said, there's going to be a live stream this weekend on Saturday night. We hope to have a lot of guests, so you know, look forward to that, and we'll be talking to you soon. Have a great day, everyone.